Aunties and mimosas. If you come in a little closer, you'll see we live life like we're supposed to. So come on in and join the fun.
Hey guys, welcome to another episode of Aunties and Mimosas. I'm your girl, Dr. Shark.
And I'm your girl, Miss Lady.
And y'all, we got none other than Dr.C here with us today. Welcome, Dr.C.
Thank you.
Yes, y'all, we're going to have some fun today.
We are.
Yes, so I guess
Happy Black History Month.
That
You got to start it with it. Come on.
Come on, say it. Okay, I guess Happy Black History Month.
There we go.
Happy Black History Month, y'all. So
Yeah, we're going to drop on down to our drink of the week, because that's the
thing of the thing.
thing of the thing. That's what we do. So
Dr. C,
we
what
have
you
an
do?
island cranberry tea mimosa.
Yes.
We got champagne, Malibu coconut rum,
Ooh, yes.
cranberry juice, sweet tea.
Hallelujah.
And, of course, top with
Some cherry.
champagne.
I thought you already said the champagne, friend.
Did I? Oh.
Yes, you can garnish it with some cherries if you want to.
No.
Mm-hmm.
And garnish with cherries.
All right.
So everybody go ahead and get
Wait,
your...
Dr. C got to ring the bell.
Oh, ring the bell.
we got a
for-
new bell
Of
for y'all.
course.
Yes,
Ooh, and
go.
I like
Just
it.
press it one
I
time,
get
friend.
to press it. There we go.
Oh, you
Did
got to
it
do it
press?
good.
Did it press?
Oh,
There we go.
Yes.
There we go.
Oh, turn it off, friend. You got to unpress it now.
Gotta press it.
It's a little
That's too
bit.
many presses.
Ooh. There we
Okay,
go.
there we go.
There we go.
All right, let's cheers it up.
Cheers.
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 Cheers. All right, y'all. Here we go.
That's
Mm.
delicious.
That's good.
And you know I'm from the island.
I
So
take
when you
that.
put- You put the
Island.
right stuff in there.
I
All
taste
right,
that
all
liquor
right.
though. That's good. I like that.
What island you from?
Gorgeous. My mother is from Haiti.
Oh,
So I actually speak Creole.
Yeah.
Okay.
Yes. A
Well.
little bilingual action.
Oh, she said bilingual.
So
Okay.
I said.
Okay. That's about all I know. That's all I got. That's all.
She know that Haitian over here. Okay, well, I didn't know you was from the
Yes, and my dad's from Nigeria.
Oh.
So I'm actually first generation born in the United States.
Nice. Okay. Go on, girl.
Full of culture. I love it. I love it.
Yes. Well, we're going to go ahead and jump down into our icebreakers of the week. And this one is going to be Black Trivia Edition.
Ooh.
Y'all ready?
Yo, Black trivia.
Okay. So, what did the 5 Heartbeats have?
In the Five Heartbeats movie?
Yeah, what did the 5 Heartbeats have?
Oh,
Don't think about it too hard
I
now.
almost said 5 heartbeats.
No, that's a good one. That's a good one, but that ain't it. That ain't it.
What did the Five Heartbeats have?
What
Mm.
did they have?
Y'all give up.
Yeah, we give up.
They had a heart in the house of the.
Is there a heart
in
They
the
did.
house
in the house tonight?
They
You know?
Yep.
That was,
Yes, they have a heart in the house. Okay.
that's good. That's good.
Okay. And what was Craig always doing?
Original Friday?
The original Friday. What was Craig always doing, y'all? Think about it.
Craig.
Craig ain't had no job.
Craig wasn't doing
Craig
nothing.
did have a job at the
Oh, he got
beginning.
fired on his
Craig-
day off.
But what was he always doing?
Mm.
Always in the kitchen.
Oh.
Eating up all the food.
All the chicken. All
Y'all
the
black
chicken.
card. Give me y'all
That
black
is
cards.
hard.
Y'all from
Listen,
it.
I know the movie, but come on now.
As many times as I've watched it.
I
I
vote
should have
for
That's a
known
good one.
that.
That's
I
a good
should have
one.
known that.
Mm-hmm, mm-hmm.
You did it. You did it.
All right. All right. So let's go ahead and jump down into our Get in Your Bag.
So the Get in Your Bag this week, we're carrying it over. So in case y'all didn't know, January was Financial Wellness Awareness Month.
Mm.
So even though January is over, we're rolling it in because there was some things that stuck out to me that I wanted to share with everyone.
Okay.
And the 2 tips that stuck out to me the most were to take stock of your emergency fund,
Mm.
especially with everything that's going on with the government
Mhm.
nowadays. You never know. They
Mhm.
ending jobs and all that
All
stuff.
kind of stuff.
And then also tackle your credit card debt.
Mhm.
So there is actually a list of 9 things that you can do to get yourself on track starting out the year. But those 2 things to me seem the most feasible and like easiest to put into place. We will go ahead and link the list of all 9. It was a stash.com article.
Okay.
And so we'll link that in our bio for you guys to view all 9.
Good. Okay.
Nice.
All right, y'all. So let's go ahead and jump down into getting your health. So February is going to be American Heart Health Awareness Month. Heart disease is one of the leading cause of death in African American communities. Do you agree?
I completely agree.
Okay.
All right.
And then African Americans have the highest heart rate disease, stroke, hypertension, and than other ethnic groups. So there's some risk factors: high blood pressure, diabetes, smoking, obesity, physical inactivity. Some solutions are going to be eating healthy, exercise, stress management, quit smoking. That's blacks, vapes, weed, all of it, y'all. And try and get more sleep. And then community health workers. Contact your community health workers. If you don't have a doctor, make sure you're contacting, seeing about your health. You know, some start hurting, some don't feel right. Go to the doctor. It's okay.
You got to be self-aware of your body.
Yeah.
You know your
that's
body
very
better
important.
than anyone.
Than anybody else. Yeah, so make sure you go to the doctor. That's just going to lead on down into our main topic. But before we get there, we got some Black history facts, y'all.
All right. We love a good Black history
There we
fact.
go.
So, I'll do one of them, and then you can do the other one because it goes more towards
Finance.
your your background. So, Robert Tanner Freeman, he was the first Black dentist, one of 6 students that attended Harvard and graduated from the School of Dentistry. So, Robert Tanner Freeman, remember him?
All right. And then I will do, did you know? So my little godson, he always goes, did you know?
Okay. Did you know?
That True Reformer Savings Bank was the first Black-owned bank in America. It was opened in 1888 in Virginia by Reverend William Washington Brown. So-
I did not know that.
Yeah.
Yeah, the more you know.
The more you know.
Okay. All right. So now we done got down to our main topic. So it's going to be primary health check with Dr.C. And so primary health, she's a primary health care nurse practitioner, correct?
Yes, ma'am.
Okay. And so what are some of your specialties?
Absolutely. So primary care is everything.
Mhm.
Anything you can think of. The way we just said, you know your body. If something is wrong, I am the person you come and see first.
Mhm.
So primary care focuses on prevention.
Mhm.
The reason we stress going to the doctor is so we can catch it before it happens.
Yes.
Before it
And
happens.
unfortunately, too often, people wait until it's too late. They wait
Mhm.
until it gets bad. They wait until they're in the emergency room before they seek that help.
Mhm.
So my goal is to help you prevent it, stay on top of it. So primary care is managing your hypertension. If you're diabetic, managing the diabetes. We do lab work, so we know if your cholesterol is high. We know if something's off with your liver. And we manage it right then and there. So most primary care providers are able to manage those things in-house. Now, God forbid, if any of those go out of whack, such as your hypertension now becomes congestive heart failure. Now we're going to help you get to your cardiologist. So we also do those referrals and work with the specialist to make sure you're getting all the right care.
Okay.
And then when you mention preventative, what a lot of people don't know, and then this is just a tidbit that I've learned throughout my years of working and having insurance, most preventative care is either free or low cost.
Yes.
On your
It should
insurance.
be covered. It
Yes,
should be
it should be
covered.
covered
So
100%.
Now the key word is should be.
Should be. Yes.
Should be.
Insurance is a different topic for
Yeah.
you. But
Let's not talk about insurance, y'all.
but it should be. So when you get your mammograms, when you get all of your preventative screenings, it's covered. So there really isn't an excuse to not get
go-
it.
Yeah.
And it's always better to know. Just because you got a mammogram last year and everything was okay, doesn't mean that something might not have
Yeah.
changed.
Yeah.
And early prevention is key. If we catch something in stage 1, very different prognosis than if we caught it in stage 3 or 4.
Yes.
So
Definitely.
it's very important to stay on top of that, and it is covered.
Yes.
But what is,
Go ahead.
personal question, for women, we have a well woman's exam. What is it called for men? What do
For
they go
men?
ask for?
It's just a wellness exam. So any primary care provider should know what to do. For women, obviously, we're going to probably do your pap smear. We're going to make sure you get your mammogram. For men, that may be a prostate check. We do colon cancer screenings, things of that sort. So no matter if it's a man or a woman, it doesn't necessarily
It's
need
the
a
same.
title, but
Title,
they should
but
know
they
what
should
to
know.
do based on your age.
Okay.
It's also based on family history.
Okay.
And I stress that a lot when it comes to preventative exams.
Okay.
A lot of people don't know, if you have a first degree relative, if your mom or your sister got breast cancer early, you can get that mammogram sooner.
Mm-hmm.
So you want to make sure your doctor knows your family history so that you're getting your care earlier if need be. Because not everyone, checking at 30 doesn't mean it's going to happen 30 plus.
Very
I know
true.
plenty of people in their 20s who have unfortunately been diagnosed with cancer. So
Correct. And from my own personal experience, because my grandmother on my dad's side had a double mastectomy, I was able to get the breast cancer screening test. I had to spit in this little tube and mail it back and do all that stuff.
Yeah.
But everything came back good. So
Good.
yeah,
By the grace of
happy
God.
by the grace of God. True.
Yes.
Absolutely. So yeah, happy about that. And then so you just got to know, even if you ask questions, I'm not super close with that side of my family, but
But you still have to ask
because
questions.
of what I was going through, I had to reach out and say, hey, what kind of cancer did she have? What is this? So that I could make sure that I got the appropriate care for myself.
And you bring up an important topic. It's so uncomfortable for us in the Black community to have
Ask.
these discussions.
Yeah.
Why is it so uncomfortable?
I don't know why, because a lot of people won't even ask their own parents, like, what's this, or parents won't talk to them about sex and things like that. I don't know why it's
always
so
thought it was taboo and they kept it
Yeah.
private.
And even myself, and I don't know if it's because I have a more cultured background. My mom's Haitian, my dad's Nigerian. I have to pry this information
Yeah,
out of them.
absolutely.
I have to say, let me see your my chart.
Yeah.
Mind you,
Oh.
other people are in my DMs
Damn,
giving me
somebody
all their
help me.
business.
Yeah, yeah.
And I have to pry this information out of my own parents. I'm like, do you know how embarrassing it would be if I had to go to the hospital if something happened to you?
And
And
I
I'm
was
like, I
don't
didn't
know.
know.
Nothing. Yeah.
I don't know.
Exactly.
Like it
Yeah.
really is a taboo, but it's important conversations that we need to have.
Yeah, and we're at that age too that we have to make sure that we're knowing these things about our parents, because we're the adults now,
There you
so
go.
they're getting older.
There you go.
And so you
No
have to
matter
know those
how
things.
uncomfortable it is. And
Yeah.
I can't stress how important it is to talk to older parents.
Yes.
Make sure their estate is in order. Make sure you know
Yes.
what do you want done just in case things go bad.
Exactly.
Do you want to be intubated? No.
Yeah.
Do you want CPR? Or you do
Yes.
not resuscitate?
Yeah.
Yeah.
It matters.
And that's
It does
always,
matter.
we don't want to think about that. And I
Mhm.
find it ironic, but my grandmother is always talking about, well, I'm not going to be here forever. So do this for me and do this for me. She will voice her choices to you. Just
Good.
it'll be a random Tuesday,
Yeah.
but she gonna voice
But
her
you know,
choice. But
we like,
you
no,
can
grandma
never say-
said.
Yeah, exactly.
Yeah.
I think that comes with age. With age,
Also.
there's more acceptance.
Yeah.
Because my geriatric patients, it's almost like they're done.
They
They're like,
like,
I
"Oh,
I'm
just
just
take
here."
care of me when the time comes.
well, maybe I'm geriatric too, because I already know what I want.
You've accepted it, and it takes a level of self assurance to
Yeah.
be able to. We all know the only two things guaranteed is you're gonna be born,
and you
And
and
don't
unfortunately
die.
we gotta go.
Mm-hmm.
So it needs to be said.
Yes.
Okay. What is the biggest health concern you see in our community other than heart health?
Other than heart health, the first thing that came to mind when you said that was hypertension.
Okay.
But I have to
Okay.
say obesity.
Oh,
Absolutely.
I have to say obesity.
yeah.
Unfortunately, we are idle.
Mhm.
It's almost as if it's an unknown luxury to work out,
Yeah.
to move your body. And that's a privilege.
Mhm.
If you woke up and you have the ability to move your body, you should be blessed
Moving.
to go out and do a 30-minute walk or
Yeah.
to lift a few weights. It shouldn't be a
A
luxury
job
Mhm.
to
or
move.
you.
Yeah, it shouldn't be.
Mhm.
And I mean, honestly, it just takes 30 minutes a day. That's
Okay.
something any provider will tell you when you go
30
see them.
minutes.
30 minutes a day.
Mhm.
But for some reason in the Black community, it's a taboo, or people wait until they get that bad diagnosis where the doctor's like, if you don't do this, it's going to get really
Worse.
bad.
Yeah.
Mhm.
Then they start to incorporate that. So that's part of prevention is
Mhm.
moving your body. And unfortunately, obesity is.
I can definitely see the
Huge.
obesity because
Mhm.
just from like some of the younger generation that's been like all on TikTok and stuff,
Yes.
like the girl with the Uber driver. He didn't want
Oh,
to get
yeah,
get in her
yeah.
car or
Yeah.
get her to get in his car because she was too big. Like, but she literally was too big, and it's
And we
it's
have to be
sad.
honest about
like
that, right?
nobody
Yeah,
said
like not
like,
being
yeah.
rude, but
You know,
nobody said
sitting in
anything
the back
about
of that C-class Benz.
we got to
like,
consider his
Daddy.
suspension in this case.
Yeah,
you know?
I was like, I'm not.
Yeah, I'm not making fun of her, but
No,
it's
not
the
hard,
health
but
we
it's
need to be real.
real.
Yeah, or
absolutely.
even what's the rapper Dave Blunt who sits on his stage with the oxygen
with the
tank.
oxygen tank. I
Like,
was like, what is
come
this?
on, sir, put down the
Yeah.
cup. Like,
Put-
put it
put it
down,
down.
Please.
and everything else.
Push
Just
away
put it
from the
down.
table. Push away.
But I understand. I can see
Yeah.
the obesity.
Mhm.
So for me, what I've been doing, because I have lost 15 pounds
that's
Ooh,
good,
since
friend.
Congratulations.
October.
Yes, ma'am.
So
Yeah, because Uncle Reese was on the thing, and that's
Yeah.
where
yeah,
that's
so
when you
I was
started.
kicking
It was a
in.
big wake up call for me.
Good.
And then I started doing my fitness pal, so I track my calories and all that kind of stuff. Because for me, I feel like I overeat at night,
Mm-hmm.
and I always want some sugar. I want something sweet, but I also got my gym membership. Started going more consistently because I had the gym membership since that August, but I wasn't like going.
Mm-hmm.
But yeah, so now that I see the difference and I see the progress, and it's like, oh, when I'm walking downtown to go get lunch, I'm not getting out of breath.
Yeah.
There you
I'm
go.
not, you know what I'm
Yeah.
saying? Like, it's
Yeah.
just the little small things.
feel
So,
Things.
yeah, as I'm going through it,
Mhm.
because according to the chart, I was morbidly obese,
Mm-hmm.
but I'm only 5'1". I weigh like 216.
Mm-hmm.
So, yeah. So, had to lose
Yep.
weight, had to get healthier.
I'm proud of you.
Yeah.
Congratulations.
Thank you.
That's wonderful.
I'm still going, still going.
That's
Going.
okay.
It's not done
It's
yet.
a journey.
I-
And even
I-
when you hit your goal weight or
Yeah.
whatever the case is, it becomes a lifestyle at that point.
Yeah, so now what some things that I'm going through right now, I can't do strenuous exercises
Mhm.
right now. And so I'm like actually missing going to the gym. I'm
Aw.
like, dang, I'm
Yeah,
bored.
I know.
But there's other little
That's
things
good.
that you can do, like
Yeah,
little
I could do the little
exercises.
stretchy bands and stuff like
Mhm.
that, but
Mhm.
it's like now that I've gotten accustomed to going to the gym, I play my little workout mix and I get
Mhm.
in a routine, and then the hour is done.
Yep.
Done.
And
Yep.
I'm like, oh,
Time flies.
it's an
doesn't
hour
it?
and 15
Yep.
minutes.
Yep.
Oh, let me go. Let me go sit in the massage chair. I'm done.
That's
Mhm.
good.
So yeah, sorry.
No,
And then
you-
anyway,
you're good,
I got on my little
It's okay.
Rant.
We talking.
so anyway, how often do you recommend that we see our primary care physician?
So that depends on what we call acuity, which means how sick you are.
Okay.
If this is grandma who keeps falling and her blood pressure's out of whack and she's not taking her medication the way she should be, we might want to see her at least every 3 weeks or every month,
Oh, okay.
right? Now, for a healthy individual, most insurances cover your wellness exam or your preventative exam, which is once a year.
Right.
I personally recommend, as long as it's covered, every 6 months to see. So that's your biannual exam.
Okay.
I also recommend, and this is something that needs to be talked about, if you need it, say, for example, if you just change partners,
Oh,
you might
yes.
want to go get checked, right?
The
There are
STD screen.
moments where
Uh-huh.
you want to
Yep,
get
yep, yep.
checked and make sure things are okay. Or if we, like we said, if that random ache or pain comes about, just because you got checked 8 months ago
Doesn't mean.
doesn't mean something might not have come about. So
Yeah, absolutely, absolutely.
Okay. What are some preventative strategies that you
Mhm.
promote for healthy habits?
that's a great question. Aside from working out, what we put in our body is what
Mm-hmm.
is what festers, right? A lot of people are like, "Oh, I'm breaking out. I'm this." Well, you've been eating sugar. You've been
Mhm.
eating all the
Sugar
fried
is
foods,
the-
right?
Honey, let me tell you.
Sugar is the devil.
Let me tell you.
And it is. It actually is. So many things stem from excessive sugar intake.
Mhm.
So honestly, I know it sounds so cliche, but the working out and eating, but you have to.
You have to.
And once you get in the habit, just like you said, going to the gym, once you get in the habit of eating well, your body will be like, what are you
What are you
doing?
doing to me?
Yeah, I don't
When
even
you
want
go
this.
back and eat
So
that
I've
bad
been
thing, it's
reading the
like-
labels
yeah.
a lot too,
Yes.
and I did 10 days with no added sugars, and that
Mm.
was the hardest thing I've ever
'Cause
done
everything
because
got added
everything in
sugar.
America got
Everything.
added
Yeah.
sugar.
Everything.
It was crazy.
Everything.
Like
Reading
going-
those labels are a little scary.
Mhm.
Reading the
Biggest-
labels,
Yeah.
like I want something to say that it just has almonds, water,
Mhm.
and wheat or
Well,
something.
you need
Yeah.
to make
No.
it all for
There you
yourself.
go. You got to make it at home.
You
If you
gotta
want
make
it
it.
simple, you got to do it yourself.
It was, and
You do.
so even buying flour that is less processed.
Mm.
Like I bought noodles that were the whole wheat noodles,
Mm.
so less processed.
Yeah.
Everything just picking all that out.
Yeah.
It was crazy.
hard.
We're all about
Yeah.
to become Nara Smith in a minute.
Look, that's
Just
okay.
make it.
That's okay. I'll be in
Get the
there
chickens in the
making
bag.
it.
The problem for me also was that going to work when I'm at home, it was way easier to make sure I had a full meal. It was healthy. It was this going to work because you don't have the time to cook.
Absolutely.
Like I didn't have the time to stop, and it's my lunchtime and make me a nice meal. Like whereas if I was at home, like working from home that day, I could make a nice lunch, a nice breakfast of this. So that also comes in, but you have to pick better like fast food choices if that makes sense.
And that's very hard to do.
But it's hard.
Yeah.
Yeah.
That's why meal prepping is so important.
Meal prep. Yep.
Yeah.
Prep is important. Okay. Any other things any other tips?
As far as people who take medication, it's funny because once they start feeling better, they stop taking it.
Oh,
I do
that's
know
horrible.
that.
And it's always interesting to hear. So it was working for you, then you stopped.
Because it was working. Why I still need it?
Right. And I will say this. I personally always recommend lifestyle changes to my patients before I prescribe medication, right?
Absolutely.
I am not the person who is going to throw a pill at you.
Yeah.
But that goes to say, if it didn't work and you need that pill, you walking around with your blood pressure in the 180s throughout the day, it's not helping you.
it's not
So
good.
if you have been prescribed medication, take that medication. It's not benefiting us as your provider. I get no money from telling you to take it. The pharmaceutical companies might, but it does not benefit us. It benefits you. And it reduces your risk of the stroke and the death and everything else that might come about from you not listening to those preventative measures.
Okay, yeah, I stopped taking some medicine.
Yeah.
Well, it's because like after I had my daughter, they said I had congestive heart failure. I was 25.
Wow.
And so they had me on all these heart medications. It was making me feel really dizzy, so I just stopped it and I haven't felt any type of way or anything
And you know,
like that.
that is situational. I'm glad you brought that up because it could be due to pregnancy. A lot of people don't realize how much pregnancy changes your
It's
body.
hard on you.
Your blood volume is going up by 200%.
Yeah.
You know, you're doing a lot to grow this human being. So when people have gestational diabetes or their hypertension is due to the pregnancy, once you're not pregnant anymore, there is a good chance that at 25, your body regulated again.
Yeah.
So it could be situational, but it depends on the person.
Yeah. Okay. What's next, friend?
So, next question is about ladies who are planning to or wanting to become pregnant. What type of tips or healthy strategies do you suggest for them to get on track?
That's a great question. You have to walk the walk before it even comes about.
Yeah.
Just like they say, if you want a job, you got to dress for the job before you get the promotion and everything else. If you want to be pregnant, you have to pretend like you're pregnant now.
Already.
So you don't change your healthy eating habits after you find out the positive. You have to start eating healthy now. Prenatal vitamins is another thing. A lot of people start taking prenatal vitamins before becoming pregnant.
Absolutely.
And that helps a lot. Another thing is just making sure your partner is also staying healthy.
Yes.
And I think
That's
a
a
lot
good
of
one.
women forget it
That's a
takes
good
two to tango.
Because, we put it all on us. And then the more that I have personally learned is like men help create the amniotic sac that the baby's actually in. So if he's not healthy,
There
then
you go.
yeah,
There you
so
go. There you
it's,
go.
It look
it's,
crazy. No, it's
I know. I
it's
know.
very important on who you procreate with.
There you go.
Very
And a lot of
important.
people only think, well, I'm carrying the baby, this,
Yeah,
that.
yeah, yeah.
But he also has to eat healthy. He also has to put the liquor down.
Yep.
You know, the smoking and all of that. If
All
you know
of that.
smoking is a bad habit for you, cut it now.
Yeah.
You don't want to wait until it's so hard and your body is going through all of these
Yeah.
hormonal changes.
Yeah.
You're going to make it even harder for yourself. So start the healthy habits before.
Absolutely. I totally agree with that.
Okay. Exercise. That's more specific. What are more specific exercises for ages? Is there anything?
So I'm not going to say anything should be limited by age. It's
Okay.
what you can do. I know older people who move better than people in their 20s and 30s. So it really depends on your agility. Obviously, some people might have had a knee replacement, a hip replacement. Okay, take it easy. We don't want you to go taking a tumble.
Right.
But obviously, the most basic exercises for anybody, walking is universal, right? If you feel like your joints can handle it, turn that walk into a jog. No one's saying you have to sprint. You don't have to turn into Usain Bolt, but move your body.
That was extreme because everybody moving that fast.
It is, but there really should not be limitations on what we say we can do in this life. I don't think anybody should limit themselves. And my personal trainer, shameless shout out to Ivy League Reese.
Okay, big Uncle
Mr.
Reese.
Ivy, but he would agree, and this is where I got this knowledge from, is there are older people who are doing so much better than people in their 20s and 30s. And those healthy habits start when you're young.
Mhm.
The more you move your body when you're young, the more you're able to do, and the less pains you have and you're complaining about when you get older. So,
yeah, and some things are, what I don't want to say reversible, but I personally
It
feel like I'm healthier now than I was in my 20s.
Yeah.
I do more activities like outside and things like that than I did in my 20s.
Yes.
Because in my 20s, I was in party mode.
Yeah.
So it was like more liquor, more this, more that.
YOLO.
Yeah.
Sleeping
all
all
that.
day, waking up at 10
yeah.
o'clock.
Having those late night Waffle House runs and all that
Yes.
stuff.
Went to
So, yes.
Whataburger. All
Yeah.
that.
And it's all about being intentional. It's something
Yes.
about when you're in those late 20s, early 30s, something in your brain said, I can't afford to do what I used to
to do
Mhm.
anymore.
You
Okay.
feel like you feel the,
Look,
the
it's
consequences.
that when you go
of
into the 40s,
There you
honey,
go.
I'm over here. I'm sleepy.
Yeah.
Yeah.
You know you can't afford those same habits.
Definitely.
And you feel better. When you know better, you do better, you feel better.
Definitely.
Yeah,
Definitely.
exactly.
Mm-hmm.
So, any tips that you would like to leave our guests or leave us?
Yeah. So a big thing that's driving me now in my career, and the reason that I started my career was to make sure we got us and we understand what's happening in those doctor's offices.
Mm-hmm.
I
Absolutely.
can't tell you how many times as a nurse, the doctor would come into the room. They would say all of these big terms, and the patient's looking at them like,
What is
What?
going on?
Yeah.
what did you?
Definitely.
But they're nodding their head, right? Because they don't
Mhm.
want to say that they don't
Mhm.
understand. And they would leave the room, and I'd be like, did you get any of that?
Nope. Mm-hmm.
So one thing that I promised myself was to meet people where they are.
Mhm.
Most people read at a second grade level, right?
That's
So
shocking.
if I'm telling you something about your health and I want you to understand it, I want you
Mhm.
to make these changes, you have to know what it is and why you're making these
Mhm.
changes.
Mhm.
So making healthcare accessible is something that I really promote, and health literacy is something that I really promote.
Mm-hmm.
So please don't be afraid when you see your providers. Ask questions, dig deeper, make them explain why they're putting you on that medication.
Mhm.
Yeah.
Why did you pick this one versus the other one?
Mhm.
In healthcare, there is never really just one answer.
Definitely.
So you have to dig, and you have to make sure when you leave, you don't need to go to Google to
To
double check
understand.
what just happened in that
Or
appointment.
even go to Google because
Yeah.
you can also understand, if that person didn't explain it to you right,
Exactly.
you can
Yeah.
go and understand and be like, oh, okay, this
Exactly.
is what they meant.
Exactly.
So,
And that's
yeah.
why my little quote for this is healthcare simplified, because I want to
Oh,
tell you
yes.
healthcare in a way where you understand it
Mhm.
and where you leave and you're like, okay, I got that. Now let me
Mhm.
go and put it into action.
Yeah.
Okay.
Yeah.
So, since the, what do they call it? The hiatus or what? No information from the CDC right now.
Mhm.
What
That's something.
are there? I know, right? Me, I'm a knowledge nerd. So even though healthcare has nothing to do with what I normally do,
Yeah.
I just want to know certain things just to be more informed.
Mhm.
I want to know what's going on.
Mhm.
So since they've taken us out of the World Health Organization and we don't have access to the CDC information anymore, is there any sites or any places that you would recommend for the average American to look at to probably gain a little bit of knowledge?
That's a good question. I'm not sure if the CDC is completely. Are they blocked off yet,
I don't
or is
think
it WHO?
it's who is,
Who
but
is
the
blocked?
I know for sure who is.
I think the CDC is certain updates that they're not
Okay.
doing, like recalls and if there's like any, I don't want to call them pandemics, but I think they are the epidemics or pandemics that are going on when it's like major outbreaks. They're
Yeah.
not posting about those
Yeah.
anymore.
So information is going to get really tough.
To find.
I'm kind of scared for
Yeah.
the next 4 years, if I'm
Yeah.
being honest. But I
Be
think
honest.
that just emphasizes the need to stay on top of your own healthcare and be intentional. Don't assume just because someone told you that they were okay that they might not have something.
Yeah.
Okay.
Wrap it up.
Absolutely.
I even tell married couples, I cannot tell you how many times I've had a married woman with the biggest rock on her finger come and see me and say she didn't want that check, and that check ended up coming back showing something else.
Something else.
So even if you think you're in a monogamous relationship, do not.
check.
Yeah.
That's the one that a lot of
Yeah.
people kind of glaze over
Mhm.
because, of course, diabetes, hypertension, all that stuff.
Mhm.
But there are STDs that
Yes.
cause other
Yes.
issues.
Absolutely.
They cause
Very true.
fertility issues. They
Absolutely.
cause brain damage,
Mhm.
cause things like that.
Mhm.
So don't just think because it's an STD that nothing else is going to happen to you.
Yes. Yes.
Because they
Get
have
checked.
secondary, tertiary,
There
all
you go.
those
There you go.
additional symptoms that you'll never
Anything
know.
untreated can turn into something
Something
worse.
else.
There you
Yeah.
go. And just like you were saying, take command of your finances. Be careful. I think it's the same when it comes to our bodies and probably everything else that we still have control over. Make sure your ducks are in a row because you really never know.
Definitely. Anything else, friend?
Yeah, I was going to ask her about Dr. C, if there is any maybe healthcare clinics, healthcare, I don't know what else they would be called, like little pop-ups maybe.
Mhm.
I don't know how they're getting out in the community these days. I'm not a younger person, so
Mhm.
I have a primary care doctor and I know who to go to.
Mhm.
But a person fresh out of college or
Mhm.
something like that,
Mhm.
fresh out of high school, their parents were like, hey, bye, and they don't know
Yep.
what to do next.
Exactly. Exactly.
Is there anything that we can
Yeah.
do to give them information on what to find?
I always say that Planned Parenthood is a good place to start.
Okay.
Planned Parenthood is very good for low income or if you don't have many resources and you need those checks, you need those pap smears, you need birth control. Even for the LGBTQ community, Planned Parenthood is a safe space. So for anyone who doesn't necessarily know which way to go, or you might not have started a job yet, you don't have insurance yet, that is a good place to start. Obviously, depending on what insurance you have, there are certain doctors that you can only see within network. And that's how you avoid getting that huge bill. You have to make sure whoever you're seeing is within network. So, but there are also, I'm still familiarizing myself with the Dallas community since I'm originally from Chicago, but there are community-based organizations. And I always emphasize that people find community organizations because they do provide those mammogram screenings. Sometimes they have a mobile mammogram that will come and you sign up. So you can get it right there in the truck, which is amazing.
Yeah, that's
So yeah, there's always a way to look up an alternative if you're in that situation.
okay. So Planned Parenthood. Now, when back growing up in Texas, I don't know if you remember this, but when we were in high school, they had Planned Parenthood come out.
Oh yeah, to the
So
schools.
to the schools and teach kids about certain things and safe sex and condoms and all that kind of stuff.
Absolutely.
So I'm wondering, because there's been so many things. Texas is a red state.
Yes.
All the way.
So they have been taking funding from Planned Parenthood
Unfortunately, yeah.
back to back to back to back.
everything.
And so I'm just wondering how active they are still in the community.
Yeah. And I think they are still active in their mission, but some of the capabilities
Are
of
limited.
what they're able to do, and I mean, even what providers and people in hospitals are able to do. Unfortunately, it could put your license at risk if you provide certain services now. So,
Oh, wow.
I think they can still give you the information, right? They can give you the baseline and go as far as they can. But unfortunately, when you are in a red state, it can limit those very important healthcare measures that you need that could save your life. So they can help you get the information you need to know all of your options.
I also saw on your page you were promoting, was it a mental health? Can you tell us about that?
Yeah.
Yeah.
Yeah, so mental health is very important, especially in the Black community. I think depression is one of those things that's another taboo
Yes.
that we refuse to talk about.
Mhm.
And it's funny because a lot of Black people think that we don't get depression.
Oh yeah.
And we don't get, these mental concerns.
Oh,
It's funny,
yeah.
Kanye just went on a rant about what he thinks he has and doesn't have. And
Yeah.
Let's
I
not
think
talk
we just need to emphasize that proper diagnosis is
Yes.
what can lead to you knowing what treatments you need. And I just recently partnered with the company Black Girl Vitamins. And I really stand behind their mission because it focuses on knowing your diagnosis, and something as simple as taking your daily vitamins can change a lot. Low vitamin D can make you feel like you're depressed.
Correct.
And a lot of Black women are low in vitamin D, myself included.
Myself included.
So
also.
when you check those levels, it is important. Iron is another thing. If you're a woman who has a heavy menstrual, there is a chance that you're low in iron. So my reason for partnering with that company was so that you can get informed and know exactly what you need to take on a daily basis. And it makes a world of a difference.
So I actually started Black Girl Vitamins
Good.
in my health journey.
Good. I love that.
Not a shameless plug or anything, but
That's
I mean,
alright.
just
It
because
is
you mentioned them,
yes.
I actually started back in October, maybe September. I can't remember when I ordered. But yeah, I do the multivitamin, daily multivitamin. I was doing the prenatal vitamin because I'm doing egg freezing. That's a whole nother topic.
You gotta tell everybody your business. You gotta tell everybody your business.
Yeah, so I was doing all their vitamins. They taste pretty good too.
They're nice gummy vitamins, right? Like a little fruit snack for you.
Yeah.
And you can use my code Dr.C20.
Okay, come on, Dr. C. We're going to plug that in there, Dr. C20 for the Black Girl Vitamins. Okay.
Yeah.
Okay, anything else for any other questions?
No questions for me right now.
Okay, Dr. C, you have anything else that you want to shout out to the people or tell the people?
I appreciate you guys for having me here.
Oh, yeah, for sure.
It is Black History Month, and I'm here with these beautiful Black women.
Yes.
For people in the Dallas area, I have started doing CPR classes.
Okay.
So that is another big thing. And I always emphasize that CPR is life-saving.
Yes.
It is not just for healthcare workers.
Not.
I've seen children do CPR and save their parents' lives.
Mhm.
It's simple steps that you can take that can make a world of a difference. Unfortunately, during emergencies, people's first instinct is to freak out.
Mhm.
And if you teach someone early that you can help before the EMS comes, it makes a big difference. So for anyone in the Dallas area, you can contact me for CPR courses and I'll travel to you.
Okay, well, send us your
wonderful.
flyer.
Yeah,
we'll post it. You know we'll post it, girl.
Thank you, thank you. I appreciate that. But I appreciate you ladies for having me. This was
sure. Thanks for
so much
coming.
fun.
It's very informative.
Yes.
I appreciate you for coming out.
absolutely.
You know, we're
Yeah,
all
for
learning
sure.
and teaching and sharing with
Always.
everyone.
And let's hope the Black community, this Black History Month, we all need to take charge and take autonomy in our care.
Yes.
Especially in these scary times, we have to make sure we're okay.
Yes.
Just in case no one else is making sure.
Yeah.
So,
Just in case,
There
girl.
you
Just
go.
in case. All right, guys. So I guess we're going to go ahead and jump on down into our Aunties Friends business this week. So we got two this week. We got Black Lick Bookstore. It's a Black women-owned bookstore here in Dallas. They have great deals, great books, and look them up on IG at I Am Blacklit. Y'all, I was going to go down to the store the other day, but I didn't make it down there. But it is so cute. So make sure y'all go. It has all kinds of Black books in there. So make sure y'all go down there. We need a Black bookstore in our community. So then we also have HTR Roadside Mobile Auto Repair. They have their phone number. I'll post that. But you can find them on all social medias at HTR_roadside. They do all kind of mobile stuff. We don't want y'all broke down on the side of the road. So hit our friend up at HTR Roadside Assistance. And friend, where can they find us at?
We gotta get Dr. C's socials first.
Oh,
Ooh,
sorry.
let's do
My
it.
bad, y'all. I'm being rude. Dr.
That
C,
is
where
all
can we
right.
find you?
You can find me on Instagram and on TikTok at Dr.C_DNP.
Okay, DNP.
There you go.
Where can they find us at?
And of course, y'all can find us Aunties and Mimosas _podcast on Instagram, YouTube, TikTok,
I'm surprised we still got
Facebook.
TikTok because last
We
time.
need TikTok.
Yeah. So I don't have my personal TikTok anymore, but
we still got Aunties and Mimosas.
but the
TikTok,
Aunties
though.
and Mimosas TikTok is still there. So
Oh,
make sure you guys like, share, subscribe, follow, tell a friend.
yeah.
Everybody,
Yes.
there's more to come.
Don't forget, we got all of our merch that y'all can purchase. We got our little shirts, the Aunties and Mimosas, Mimosa Me Please.
Ooh.
And then also, we got friends.
Our
Got a
Mimosa
little
Be
book.
Please recipe book.
Yes, so make
Oh,
sure y'all
that's
get one of
nice.
these. Y'all can find us on the Shopify.
Shopify.
It's on our page. What else, friend? What else we got coming? Oh, no. She don't know, y'all. No, next week we got Curbside Conversations
Oh,
coming
I did know
in.
that because I talked to them already.
You sure did. So we got Curbside Conversations coming in to join us next time, guys. Other than that, Dr. C, thank you so much for
Thank
coming
you for
out, talking to
having me.
us and the community.
I appreciate y'all.
Yes, other than that, y'all.
We'll see y'all next time.
We'll see y'all next time.
Bye.
Bye.
Aunties and mimosas. If you come in a little closer, you'll see we live life like we're supposed to. So come on in and join the fun.